Welcome back, everyone. Erin and Michelle here. Today, we want to talk about a topic that we've covered a little bit in the past, but in more depth with some examples and just making it something that you can relate to your life and what we all go through as humans. So, we want to talk about the biopsychosocial model of health and pain management. And this is a model that we've talked about in the past. It's different than the biomedical model, which is kind of the historic and most common model that you see in the healthcare system historically. And that is something that we would like to see change more. And that's a lot of what we are talking about in this podcast. And we mentioned this statistic before, but I wanted to mention it again because I think it's really profound. The CDC came out with some information this past year, 2020, in this study, which was from 2019. They had 20% of adults that had experienced chronic pain in the past 3 months. That's a big percentage of people in the past 3 months. And so this is something that's significant. It's all around us. And so that's why we want to talk about it more. So Erin, why don't you start by just giving us a little bit of an understanding of the difference between these two models and what they mean?
I'd love to. So the biopsychosocial model is the model we've talked a ton about. And there was a great analogy on another podcast I listened to called Pain Reframed, and we'll reference it in today's notes. But the psychologist they interview, Rachel Zoffness, talks about really looking at the biopsychosocial model as a Venn diagram of three circles. So you have your biology, which is what we talk about a ton in physical therapy in a lot of medical offices, and it's still hugely important. But we also have our psychology and thought process, our nervous system, which again, Michelle and I have talked a ton about, the point of this podcast, and
Yep.
socially what's happening. So your family and loved ones around you, what's happening in society, and all three overlap in different parts, right? We all know what that Venn diagram looks like, but they come together in the middle, and that's what kind of builds up our pain experience and ultimately health experience. So
Yep.
when we don't talk about the psychology around pain and your nervous system or socially what's going on, we're missing more than like half the puzzle. And there's
Yeah.
definitely some limiting factors for sure where there's
Right.
pain is so multifactorial, so I don't think it touches on everything, but I do think it's a nice job, and I talk about this frequently with people in my office, of just acknowledging and validating all three parts of that model that build up our pain experience.
Yeah. It was funny. I was reading an article that was talking about the biomedical model. And one of the things they mentioned what was with this model, it's essentially looking at disease processes and our body and all the different systems as either normal or abnormal.
Yeah.
And I read that and I was like, no,
Yeah,
because there's what about all the in between,
exactly.
right?
All the
Yeah,
gray.
just
Hmm.
exactly. So that's what we're missing with the biomedical model is it's not looking at all of these factors. And this biopsychosocial model doesn't negate the biomedical aspects. That's a big part of it. That's one third of it.
Yeah.
But it's just reminding us that we have to, as health providers, look at these other things too.
Yeah, definitely. I couldn't agree more. And it happens often in clinic with people where, yes, the biology is important. I always emphasize that for sure. But it's literally why we're doing this podcast is to increase public awareness of our nervous system. Let's remind people 45 miles plus your brain, which is pretty substantial,
Yep.
and our social experiences that all impact kind of our disease process at times, what we're feeling if we have an injury, or even like this, persistent pain that we experience that feels random and can kind of build up over time.
Yeah. Yeah, and I think when you've seen, as someone who's coming into our office, we see all the time where it can be really frustrating when the providers that you've dealt with have been more coming from that biomedical model of care, and that's the kind of information that you're getting because we've talked about in the past where we often see people who have been told, they've done all these tests and images and there's nothing abnormal. Everything looks normal on there. And again, okay, great. That stuff that they looked at is normal. So we
Mm-hmm.
know that we're not having to manage these other things, but that doesn't mean that there's not something else going on. And that's what we're there for.
Right, is to validate that experience. And I think,
Yep.
it's so important to acknowledge these other parts. I tell people, like, if I'm not acknowledging these parts, I'm not doing like 2/3 of my job. I'm not doing a
Yeah.
huge portion of my job. And
Yep.
I hope that a lot of this is just really validating for you. Like, let's talk about what's going on with these other parts because this is real and it's happening, just like we said.
Yeah. Yep. So, Erin, tell us about the example from someone that you saw in the clinic this week. We were just talking about it because I think it's really great to mention.
Yeah, I talked about this I drew out this great Venn diagram that I loved. I think that that's such a great way to explain things and get people visualizing it. And I've been seeing this person for persistent knee pain she's had it for, goodness, over a year now. Imaging has been clear. There is no, again, biomedical cause, but it's happening it's
Right.
been really consistent. And anyways, we were talking about just the psychological impact and society, what's going on. I did mention that study in the sense of we're in the midst of a pandemic and a lot of hardship with just what's happening in the world, and that if we're not recognizing those things, we're not giving ourselves the validation and self-care we need of why this is
Yeah.
happening. And when we got talking, and like I said, mental health comes up all the time, and I'm promoting it all the time because, I'm like, do you have an awesome therapist that you talk about your knee pain with them? Like, do you bring up your knee pain? This sounds pretty familiar. We've really given the analogies of mental health to physical therapy at times within our scope of practice because of
Yep.
talked about shame pathways sharing the same as physical pain. And she looks at me and she goes, my mental health therapist has no idea of chronic knee pain.
I bet they wish they knew that too.
Totally. It's just how when someone opens up about trauma, which is so frequent in today's society, I always thank
Yeah.
people because it helps us really validate
Oh
all
my
these other
gosh,
things for
yes.
them.
Yep.
And I said, well, who do you talk to about this? Like, you talk to me about it. That's great. But, what are you doing? And she said, well, I call my mom every day and she is so nervous about why my knee still hurts. And she calls me every day and we talk through it. And she talks about how I could seek help and that she's so nervous for me. And it's a great
Yeah.
time for me to vent and get it out. And I said, oh my God, I'm so glad we had this conversation today. Because let's look at
Yeah.
this Venn diagram again. You and I have been working super hard on, the biology and what we need to build up or stretch out to support your knee for sure. But let's think about the psychology. You're literally telling your brain every day with this conversation with your mom that something is wrong.
Yeah.
Something is wrong. Something is wrong. And we know that your nervous system, this is that psychology, the 45 miles we're tending to, that totally we're working on that. We're rewiring that right now. And I'm
Right.
not trying to take that away from you. Let's validate that. But socially, you're also getting support from someone who's only means it out of the goodness of their heart, truly.
Yeah.
But kind of
Absolutely.
reiterating again that something's wrong, something's wrong, something's wrong. How can we help you? So I
Yeah.
know a lot of pain clinics in the United States, even, which not many are up to date with this biomedical model. It's getting better. So I love it. I love a lot of pain clinics in the Twin Cities. I think they do an awesome job. But anyways, they talk about limiting your conversation to just your providers. And the
Yeah.
reason why that's so important is because you are literally retraining your brain to stop going through that wrinkle or that passageway that something is wrong. Mish, you and I have talked about mantras, mindsets, things like that. Those are when those come
Yep.
in. Super important.
Right.
And I never
Yeah.
tell people we're not ignoring it. We're not, telling, like, mantras are great to have a moment to validate and acknowledge it. But then you're
Yep.
getting your brain down that dark kind of tunnel of something's wrong, something's wrong. Why haven't I figured this out yet?
Right. Yeah. And the mantra's there not to try to forget
Yes,
what's happening, but to be in it with yourself
exactly.
because it's part of the present
Exactly.
experience. Yeah. And I think the fact that this example and this person that you're talking about, the fact that she has you and the mental health therapist, that when she's having wanting to have these conversations about pain, that she can talk to people who have these amazing and different expertise, and the two of those together can be really, really
So
powerful.
powerful. I mean, we said that with some of the clinicians we've interviewed, where it is a team effort. And in fact, after that visit, I said to her, "Oh my goodness, like, give your therapist my card. If it's like, we need to
Yeah,
start talking because all the things
absolutely.
you're talking about." I mean, she was like, "Yeah, you're speaking the same language as my mental health therapist." And I was like, "Totally." And I'm going to stay in my scope of practice because I love all
Right,
my mental health therapists, and that is not where I'm
right.
trained. But we are going to apply it to your body, and it is going to bring up some of those other thought patterns. So
Yeah,
let's get everyone on board so we can best support you. And the best
yeah,
pain clinics in the Twin Cities, I mean, oh my God, Dr. Kayla, U of M Health,
yeah.
it's a multidisciplinary team. That's important. And full
Very
circle, it's
important.
because of this biopsychosocial model that we've researched for 2 decades and we have good science on.
Yeah, yep. Yeah, that's such an awesome example. I'm so glad you shared that because it really reiterates the fact that there's this biological
Mm-hmm.
thing going
Yeah.
on. We know that's
Mm-hmm.
present in part of it, but all of these other experiences are so important. And the take home point here being is that there's the biology, but we also have to consider our environments, our individual experiences, the experiences of others around us, the pandemic. There's all of these other things. And if we're not looking at all of those things together and how those things are interacting, we're not optimally managing health.
Right. I mean, you couldn't have said it better. I end that with just the importance of vulnerability and processing.
Yeah. Yep.
Crying happens in our office a lot,
All
and
the time.
people I are often apologizing, and I'm like, oh my goodness, no, there's nothing
Don't
to apologize
apologize.
right now about. Like, you are processing this, and this vulnerability and a process you're going through is so, so amazing. And we have this stigma in psychology still, and mental health, which hopefully again we kind of erase that stigma, because most of the time, we're trying to transition that thought process away from my body's broken to body
Yeah.
positivity and validating all the things you're going through.
Yep.
We're not trying to ignore them or tell you they're not real. They're just so multifactorial with all these things. And,
Yep.
we said this before, Michelle. How often do you sit with someone and you're talking for 20 minutes to 30 minutes
Yeah,
of our
happens
40-minute
all the
visit?
time, all the
Mm-hmm.
time. And I think it's so helpful, and I never have moments. I know I did early in my
Mm-hmm.
career where I was like, "Oh my gosh, we didn't get anything
Yeah.
done." But now I'm like, that was so
Yeah.
successful. Like there was so much good that happened there.
Totally.
And a lot of it is validation, going through that process, which includes a lot of
Yeah.
emotions and knowing that that's part of
Mm-hmm.
it, and that's where you make change
Yeah.
too.
Well, and you said it
So,
perfectly to begin this episode of, pain is part of our normal human experience, and there's no avoiding it, and there's not a quick fix. Look at our opioid epidemic. It's another dark
yep.
hole I don't want to go down right now. But if we're not talking this way and not educating the public this way, we're going to be confused for a pretty long time. And
Yep.
this stuff, it works. And we see results when we start thinking
Yeah.
big picture. And again, taking kind of that 300-foot step back and looking at all parts of this. And, even with this person I saw, then talking through with her of the self-talk around her knee pain and what she talks about with her mom. And a lot, was I'm broken. It's a lot of that shame talk
Yeah.
and things like that. So it's so powerful to even relate it to your body, because we will
Right.
sometimes only relate it to emotion or what we think about typical mental health. But yes,
Yeah.
I mean, making the connection of how intertwined those worlds are is just pretty amazing for someone to realize.
Yeah. Yeah, that's really awesome. Well, I think that's a good place to wrap up. So thank you guys for joining us. We hope that you feel like you have a little better understanding of this healthcare model. And remember, if you have any questions, you can always email us, and we'll include that again in the show notes here. But please don't hesitate to reach out if you have any questions, and have a wonderful week.
Thanks, guys. We really want to hear from you. So shoot us some questions.